You are listening to Radio Ramadan 365 podcasts.
Assalamu alaikum, listeners. Welcome back to What's Your Specialty here on Radio Ramadan 87.7 FM. So, I'm your host, Dr. Nadeem Bhatti, and I'll be talking to various doctors from various specialties and finding out what their journey is like in their profession and what it's been like. And because we're on Radio Ramadan 87.7 FM, we're going to find out a little bit about what their faith, how that is impacted on the job that they do. And so without further ado, let me introduce our next guest. So I'm really, really pleased to meet Dr. Shazia Shabir, who's a nephrologist who at the moment is working in Birmingham, I believe.
That's right, yes.
Okay, Assalamu alaikum, Shazia.
Walaikum assalam.
Really great to meet you. And listen, I guess the question I've got to ask first of all is, look, why did you do medicine?
Okay, well, it was definitely not in the initial plan. When I was in primary school, I used to watch the news with my dad, and whenever they talked about the economy and all those gold shiny pound coins were dropping, I used to say, that's where I want to work, where all those gold shiny coins are dropping. And my dad said, you do know that they extensively search the employees, including the heels of their shoes when they leave, so you won't be able to tuck anything away. And then as I got into secondary school, I remember doing a home economics class, and the teacher made a chocolate cake and then took it home. And I thought that's a really great job. You get to cook as part of your job and then take it home. So I thought I'll be a cookery teacher, and which everybody chuckles at because I do very little cooking as an adult. I'm not known for my kitchen skills. So that provides a lot of amusement for the family even now. And then, of course, the Amstrad computer came out, and I was doing business studies, and I really liked using the computer, so I thought I'd be a businesswoman. Again, this makes everybody laugh in the family because I'm hopeless with money as well. So it was my sister who planted that seed into my head, which was, she made a real point about going to my parents' evenings. My dad worked permanent nights in a factory, and my sister did experience racism at school, and she was very mindful about the stereotypes that were being stamped on Asians and the ethnic minorities, which are these people are not particularly interested in education. Their parents are not particularly signed up for their education. So she said, I'm definitely going to your parents' evenings. You know, we are very much signed up for education and progression in education. And when she went to my parents' evening, she'd said to me, well, you know, you're good at science, you've got good marks in all of subjects, why don't you consider medicine? And at that time I'd said, no, I don't want to be a doctor. But later on, as I was progressing in secondary school, I thought, actually, I do really enjoy science, but I enjoy it as it's applied to people. And then I started to think about medicine as a career. And I think whilst I was doing my GCSEs, that's when I consolidated in my head that I would like to become a doctor, because I enjoyed science applied to people. And that's where it all started.
Wow. Okay. So did you come from a very, I hate that word, educated background, but did you come from a background where academia was really favored and really pushed, or did it come from within you?
So I was born in Pakistan in a tiny little remote village, and I came to the UK when I was 7 years old.
Whereabouts were you born? Just in case you're near me or something.
I was born in a little village called Hasalpur, which is, the district is Bahawalpur, and the nearest big city is Multan. So we're from the Punjab region of Pakistan. Our dialect is very much like the Sikh dialect, Punjabi. Yeah. And when I came but yes, on my mom's side, even though both sides of my parents, they are landowners and farming land, but education was a big part of both families' ethos. So on my mom's side, all of her brothers are well educated and hold really good professional posts in Pakistan. She was the only one in all her siblings who didn't get an education, because she was born in India, and then she was 2.5 when India and Pakistan split, and there was no schools. in the village that they moved to in Pakistan, and so
Yeah.
she and her father didn't feel it's safe to send her 7 villages down the road.
So she sort of slipped through the crack there.
Yeah, she
Yeah.
was the only one. And when her younger sister came along, and her younger sister said, I want to go to school, and there still was no school for girls in the village. And then my grandfather had a school commissioned for her, and that's how the girls' school started in that village. But my mom slipped through the cracks, and her mom died when she was 11. So then other duties took over. But yeah, so and then on my dad's side as well, my dad did he was a maths and geography teacher in Pakistan, and when he moved to the UK, he tried to enter the teaching profession, and he was told that we don't accept Pakistani qualifications. And then he tried to enter the police force, and they said we don't accept coloured people in the police force. And then he took up a job as a labourer in a factory. But education was a big part of our upbringing, which is my father said 2 things will never fail you in life, and one is land, and the other one because it provides for you, and the second is your education, because learning is from cradle to grave.
Okay, mashallah. I mean, we could spend like an hour just talking about that side of things and how that happened. I mean, I remember my dad saying to me once, you either come from an educated family or your father values education. So it's clearly there was both there. So can I ask you, so you got into, how did you decide that medicine was the answer and that's what you wanted to do at that stage? And how did you then progress on in that?
And my I had a really great science teacher in secondary school, and he whenever he was teaching science, he was really giving practical examples of how it's applied. Because of his great teaching, I was really drawn to science. And my elder cousin, who's just a couple of years older than me, had decided that he wanted to do medicine. So I think I then had that as an example. And it was so, yeah, that's how the seed was really sown.
It's amazing what a difference that teacher can make, what difference teachers full stop can make. You forget that until maybe years later, then you realize what an influence they had.
Yeah, and when I went to college, I had my science teacher in college had said he was steering me away from medicine. He said, "Oh, you know, really, the truly intelligent people become researchers and scientists, and those that are not that intelligent and just want to reciprocate what's already known, that will be the doctors. You should go to science." So he tried to
All
steer me
right.
away from medicine, but yeah, that didn't work.
And did you go to university in England or was it?
Yes, I went to university. I went to the University of Liverpool. I applied. My plan was to try and get a place in Birmingham, and the interview was pretty frosty. And there was a lot of biases at that time, which in the interview they asked outright, "Are you intending to stay at home if you were?" Because I only lived down the road, literally. "Are you intending
Wow.
to stay at home, or will you be moving into halls of residence if we offer you a place?" And I said, "Well, I'll be living at home." And then there was quite the reaction, which I was not expecting in the interview to that. And they said, "Well, how will you form friendships with your fellow students, if you're living at home?" And so on. And they completely took a different, very biased
Got it. Absolutely.
tangent. And it was like a foreign concept to them that somebody would want to stay at home
Yeah.
at a university level. That was a really alien concept. And of course now, it's not just the Asians who are staying at home. It's become a lot more widely practiced.
Work sometimes to stay away from home. It's so expensive now. Uh,
Yes,
so absolutely. So you went to Liverpool. You did medicine. I'm assuming you enjoyed it.
I did. Yes, the first year, I remember yeah, it felt hard because it was quite a transition from college, where it was a smaller class and a lot more structured teaching, to a lecture theatre with a couple of hundred students. It was dental students, medicine students, some other allied specialities as well. And you have a lecturer standing in the distance and they're delivering a lecture. And I remember grasping the first 10 minutes, and then after that, it just went straight over the head. And I just thought, oh my goodness, am I out of my depth? And I remember feeling out of my depth for the majority of the first 2 years. And then it was only when we started the clinical placements that I really felt, yes, I'm doing the right thing.
Wow. Okay. That's a really interesting thing you said there, and it's really important for other people to understand that you're going to start off, and it might not necessarily feel like, wow, this is great, but you've got to stick at it.
Yes.
Yeah. And so, mashallah, you got through that, and then how did you just? I mean, you're a nephrologist. Just for the listeners, could you explain what that actually is?
It's a kidney doctor. So I deal with kidney diseases.
Okay. And how did you decide, oh, kidneys are for me?
I didn't. So when I started my medical placement, hospital placements in medical school, I decided from that stage that I want to be a cardiologist, which is a heart doctor. I really enjoyed my cardiology placement, and I was always drawn to the cardiology cases as well. So from third year of medical school, I had that clarity, and I tried to keep an open mind. And as I went through the rotations, I remember doing my obstetrics and gynecology rotation, and the first day being sent to the labor ward, I was wearing really lovely blue suede shoes and a white blouse, and a session in the labor room, and I thought, this is not for me. I like my nice shoes, and I like white tops. There's too much spillage here. So that was off the chart. And then I thought, oh, I think I'd quite like ophthalmology. And I remember going to the operating theatre and the eyeball. Once they started operating that, I thought that's definitely not for me. And as I did gastroenterology, there was too many gunky secretions as well. So I thought, that's gastroenterology out, that's respiratory out from all the sputum and so on. So I thought, cardiology is a clean specialty. I don't have to deal with any horrible secretions. So, and then I did my house job and my SHO rotations. And as I came towards the end of my SHO rotations, I still had my final bit of the professional exam to do, the PACES exam. And I remember saying to the cardiologist that, what should I do now? And they said, go off to the Queen Elizabeth Hospital and do 6 months of kidney medicine, and then clear your exam, come back, and then we'll set you up with some research in cardiorenal, because that's the next big thing. Okay. So I went off to do 6 months of renal medicine, and about a month into the renal medicine, the nephrologist started to persuade me what a great speciality it is. And I remember one particular ward round, and we were going through the hospital seeing patients dotted around all over, and the nephrologist was saying to me, oh, look, there's a miserable looking doctor walking by. I was a cardiologist. And I think he was plugging how happy the nephrologists were in their specialty. And joking aside, what I found with renal medicine was that it really spanned the whole breadth of academia, intervention, the acute side, and the chronic conditions. And then we had kidney transplantation, and so it was a multi-system speciality, and the breadth of it is really fantastically interesting. And also, I think for me, the game changer was that I found that the nephrologists were delivering a 7-day consultant-led, consultant-delivered service, and they were really committed to their patients, and they were committed to training as well. So as a junior doctor, you were never left unsupervised, and you had really good mentorship, great support and on formal ward rounds, but even between ward rounds as well. The consultants would always pop up first thing in the morning and check that you're not worried about somebody that that they need to review. They would check before they would go home each evening with you on the ward. Is there anybody that you're worried about? Anybody that you want me to see? And I didn't really see that when I was doing a lot of the other specialities. And I thought, actually, this is a specialty that's going to provide me good training, and that's the kind of doctor that I want to be. Someone that's that committed to their patient and that committed to their trainees as well.
Now, I mean, it's interesting. I mean, obviously, views have changed with people from different ethnic backgrounds and religions and things. It should be a neutral space for all, but it often sometimes isn't. Did you feel any of that, or did you feel well supported as you went through your training?
I felt supported during my training on the whole. When I was a medical student and just prior to starting my surgical attachment, I was really mindful about the attire in theatre, deep necklines, and I would be just in a little cap and short sleeves, and I thought I'll make an appointment and go and speak with the surgeon that was going to be my supervisor during the rotation, and just to ask whether I can wear the long sleeve gowns between theatre cases while we're waiting in the theatre coffee room and so on. And I honestly thought that I was doing the right thing. And my goodness, that lives on with me. It's left a fingerprint. He reacted really, really badly and said, "Who do you think you are? If this is the views that you hold, you should not be pursuing this as a profession." And so
This
on and
was
so
something
forth.
when you were doing a surgical rotation or
Yeah, surgical rotation as a medical student.
as a medical
And as a
student?
medical
Wow.
student, yeah, really, really unpredictable kind of a reaction that
Can I
certainly
ask
not one that I
when
hadn't
this would
predicted.
have been around? Like what year this would
I
be?
joined medical school in 94, and it would have been probably 1997.
Wow.
Yeah. So
So
that was that then affected the lens with which I viewed surgical experience. And although then later on, when I started the speciality, he then was really impressed with how much effort I was putting into seeing the patients when they were coming in for pre-operative assessment, following them through to theatre, and then following them after theatre as well. So I was following the whole journey. And when he would be asking his registrars or his SHOs in theatre details, clinical details, they were sketchy. And then I was able to fill in. And then he told them off and said, "Look, she's knows more than you guys." And then he started asking me to scrub up with him to assist in the cases. But the damage had already been done by this stage. And it's that's what you said at the start, which is, isn't it amazing how much of a difference a good teacher, a good mentor has? And I suppose this is an example of
this was the opposite.
this was the opposite example. And so I really never entertained surgery, because when I looked at the demographic and the environment of surgery, I just at that point I felt I'm making a choice between my deen and the profession in terms of how I'm going to lead my life. And I felt that if I chose surgery in that era, that I was going to really significantly compromise my deen.
Now,
And
it's funny. I've done about three of these interviews so far, and you're the first female that I'm speaking to. And so suddenly the whole question of balance, family, because often let's face it, we do expect the female to be the person who's at home, looking after the family, bringing them up. And this idea, even the idea of what you wear hasn't been an issue for any of the male doctors I spoke to. They talked about other things. So there's like a whole area here. So I suppose if the question I'm going to ask you is, I mean, that obviously had an effect on you speaking to the surgeon. At what point did you think is this going to be, by taking up this profession, is my life going to be out of balance? And what am I going to do about it? Was that ever a question?
No, no, alhamdulillah, it wasn't, because I think I'd when I was, the Gulf War had broken out when I was in secondary school, and I had a mixture of Muslim and non-Muslim friends, and the non-Muslim friends started asking a lot of questions about, well, what, is this Islam that we're seeing on the screen, and is Saddam Hussein representative of Muslims, and do you share those views, and why does your religion say this, and why does your religion say that, and so on. And I used to come home and ask questions to mom, because dad would be asleep during, just as he'd be just leaving for work as we were coming in, and then he'd be at work during the night. So I asked if I asked my dad, actually, he used to say, we don't debate about religion, and we don't hold discussions about religion. Each person, to their own kind of thing. Religion and politics are two things that you should not debate about. So that was
Very
my dad.
English.
Yeah. Yes, that's right.
Very
And then
English.
yeah, and he certainly did hold that notion, when in Rome, be like the Romans, and that's because of his experiences when he first came to the UK. He was not married, and he was renting a room in an English lady's house. And if he walked out in shalwar kameez, she'd say, "No, no, no, you're not allowed to come out of your room in your pajamas." And so, that was firmly etched into his memory as well, and that affected how he moved forward. And with mom, I would ask mom the questions that I was being asked, and my mom would say, "Actually, I don't know." And I said, "Well, why do we do this, and why do we do that?" And she said, "Well, I don't know. I saw my father, my grandfather, and doing it, so I do it as well." So then I started to read. One of my brother's friends had started practicing Islam, and the first book that he gave my brother to read was about Tawheed, and I read that book from cover to cover, and then I started to read more books, because I felt, actually, if I have the label of a Muslim, then I need to understand what Islam is. And if I can't understand it, then how do I explain why I do things in a different way to the person that I'm sitting next to, And so once I started reading, then that really consolidated my belief. And it was when I was in college, and I was coming towards the end of my first year in college, that I started to wear the hijab. And I remember coming down the stairs at home, and my dad looked at me and said, "What's that you've got on your head?" And I said, "Well, it's a hijab." He said, why are you doing that?" And I said, "Because that's what Allah subhanahu wa ta'ala has commanded." And he said, "You're not in a Muslim country. Why are you going to draw attention to yourself? And you're going to be disadvantaging yourself by sticking out. You should be blending in." And I said to my dad, "We're in a different era to when you came to the UK. Yeah, we need to have confidence in expressing our differences, and our culture, our religion, and there's no harm in that. Doesn't mean that we're saying that we're not part of society, but we can still embrace and our
And did your dad accept that?
He wasn't comfortable with it at all, and then over time, as he then saw that it did not hold us back, that I went to school and my teachers were fine. They were all Caucasian, but they were absolutely fine. I had Muslim and non-Muslim friends, and they were fine. And the non-Muslim friends asked questions, and I was able to answer. We set up the Islamic Society at college. We asked for a prayer room. And one of our friends who was a lot more learned, we got him to do little study circles once a week as well. And so it was great. There was a whole movement starting at that time, which was really exciting, of, my generation of Muslims really learning what Islam is and having the confidence to talk about it and express practicing it as well. And then when I went to university, one of the first things I did was to seek out the Islamic Society and join that. And then I was the lead sister for the Islamic Society for a couple of years as well. And we organized, various speakers and events and so on. So I think that gave me a lot of confidence with being a Muslim in a predominantly non-Muslim country.
Yes. Yeah.
And not feeling that I should be restricting myself in any way, or that I should be expecting accepting a different pathway to the one that I desire. So I used to wear the jilbab throughout medical school. I wore jilbab, and the only time I didn't wear jilbab was the abaya was when I was going to the clinical placements in the hospital, and that was fine. The only time that I think I felt, gosh, have I got this wrong in terms of how I'm explaining things, was when a fellow Caucasian medical student took his hand out to shake my hand in the early years of medical school. This is before I'd hit the clinical placements. And I said, I'm really sorry, I can't shake your hand. It's against my religious belief. And he reacted really badly. He said, I'm not going to rape you, it's only a handshake. And I wasn't expecting that. And then he said, well, how does this work then with you going on to becoming a doctor? You're going to be examining male patients. And you're telling me that you can't shake my hand. So, and he didn't speak to me for the rest of the time in medical school.
I think, mashallah, firstly, I've got to say the courage you showed by not standing up to your dad, but actually, fighting your corner and explaining your viewpoint. I don't know if I would be able to do that at that age. And also, I think is definitely was more difficult for a lot of the sisters who wanted to express their Islam because they had to wear the hijab. Now, a lot more brothers are wearing beards and things at an earlier age and things, but they didn't really have to change anything back in those days to say that they were Muslim. So I have to applaud you. That takes a lot of, I think, more courage than I would have had, especially with my dad at the time. But the other thing is that, when you enter into Islam, everybody, other people expect you to be an expert or a mufti on everything. And it's very, very difficult. So I can imagine, I wouldn't even have known where to start with some of the things, like, why do you have to do this and why do you have to do that? We're just starting with the basics. So I can imagine how difficult that must have been for you. So, do you look back on that time now and think, you have a lot more sympathy and compassion for yourself at that age?
Yeah, I do reflect, and I tell my boys now, because now things are a lot more widely spoken about, and there's a lot more understanding amongst non-Muslims about the do's and don'ts of Islam. And there's a lot more tolerance as well. And you're not, for being different, you're not now perceived as somebody who doesn't want to integrate, as someone who's not who's not accepting of other ways of life. And I remember when I started to work, and whenever there was a work due and I'd be invited, and I always found myself in a real conundrum, because it was going to be in a restaurant where there's going to be alcohol served and alcohol consumed at the table. I remember when I started university, and friends were wanting to go out, and I didn't know what I could and could not do. So I rang somebody who was learned and said, it's going to be at a restaurant where alcohol is served, but there won't be alcohol at our table. And so he gave advice on that. But when that was fine. But when I started working, then it was work dues where alcohol was going to be consumed at the table, and probably by the person sitting next to me and so on. It'll be often the case where I was the only Muslim. It was often the case where I'd be the only Muslim, the only hijab wearing person, and that's fine. But, so that means that alcohol is going to be consumed left, right and center of me. And therefore I didn't used to go out to those particular gatherings. But then I was mindful I didn't want to cause offense to my colleagues who I really got along with. And didn't want them to think that I don't want to, that I don't value their friendship outside of work and so on and so forth. So that I used to have to explain, and I did explain, but I was always hoping that it didn't have the same reaction that I experienced when I said I couldn't shake your hand back in the early days of medical school. And that had left a fingerprint as well. So those, and when it came to fasting as well, of course, there wasn't that recognition of fasting. So, and Eid as well, there wasn't the recognition for Eid. It was just a regular day, and trying to make swaps with people to have a day off on Eid was almost impossible. And, there was no flexibility, of course, in the working schedule when it was during Ramadan as well. So, but now I'd talk about it. And then colleagues would try to be understanding, but they would always forget. And on a daily basis, they would say, "Would you like something to eat?" And I don't know why, but during Ramadan, you were offered the most food and the most drink. and then by the time they'd register you saying for 30 days, "I can't. I'm fasting. And then they'll stop offering you things, and you'll be like, "I've stopped fasting now. You can start offering me things." But now I have colleagues, and it makes me really happy. I have colleagues who are wishing me Ramadan Mubarak a week ahead of Ramadan, would be saying, "Oh, your Ramadan's coming up," and so therefore things have progressed so much, and it makes me really happy that things have progressed.
Mashallah. I was going to say, have you noticed a difference now? But obviously you must have. And you work in Birmingham, which is, well, I think it's the most mosques in any city, I think, in the UK. So it's obviously a kind of familiar thing. I mean, that's in terms of the deen, but in terms of your family life, we know how difficult it is when you're going into a specialty with the studying and the work schedules and things like that. And I have met sisters who have gone into specialties, and it feels as if they've had to give up almost like their family life for the sake of their profession. And I feel very sorry for them because time passes and they get to a stage where it's too late to sometimes to change things. Is that something that you experienced, and did you try to make a balance, and how difficult was that? I just wondered if you could share something about that.
Yeah, and I have a lot to thank my dad for with regards to that, which is that my dad really never pressurized us into what we should do, other than we should all aim for university. And secondly, he didn't entertain marriage as in arranged marriage for any of us, or the concept of marriage. He said loosely a couple of times, "I'm not going to be arranging anybody's marriage. So if you at any point find somebody that you like, as long as they're Muslim, you let me know." And I remember when I'd qualified, and if there were inquiries made, to my mom, if people approached my mom, and my mother would say, no, she spent so long studying, and now she needs downtime and time to focus on developing her career. And so, and if it was something, if it was a proposal where my mom thinks maybe it's somebody we should be considering, should run it by my dad. And my dad was like, "Nope, unless she's saying that there's somebody that she wants to marry, you let her focus on her career." So I never had that pressure. And I married at the age of 28, when I found somebody that I wanted to marry, and so on. And then I also delayed having children for about 5 years as well. And I didn't have the usual Asian pressure for, well, you've been married X number of time now, when's the kids coming along? And my husband is 7 years younger than me, but he was really understanding as well. That I wanted to try and get through as much of my specialty training before I'd.
Now, can I ask you? That in itself is there must have been some. That can be problematic for some people, especially men who think, "Well, wait a minute, why should I put my life on hold for my wife?" But mashallah, there's nothing wrong with that. But how did you deal with that, and how was I guess what I'd be interested to know also is, what did the wider community think about it? You must have had people going, Sure, what is she doing? What's that? Or maybe
Well, the
speaking to your
wider
dad.
community, my dad was never entertaining of the wider community.
Mm,
I grew up in Spark Hill, which is like mini Pakistan
yes.
of
Yeah.
Birmingham. And when I remember when we were in secondary school, and my sister and I wore trousers as part of the school uniform, we weren't wearing hijab, so we had short shoulder length hair and so on, and we were surrounded by predominantly Pakistanis who were from the Azad Kashmir part of Pakistan,
Mm-hmm.
and they had a very different lens to
Yeah. Yeah.
education, and especially education for girls. They really didn't. There was no. They didn't value put a
Yeah.
value on education for the
Yeah.
girls. And what they typically did was pull the girls out of secondary school, and take them off to Pakistan for a couple of years and then bring them back. So they're neither here, neither there, in terms of
Yeah. Yeah.
education. So there's quite a bit of that happening. And I remember, certain women from that community stopping my sister and I in the street and saying, "Oh, you're going to go to hell. You've got short hair in Islam. Women are not allowed to cut their hair." And my sister and I were only in our early teens, and you're wearing trousers. Toba, 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 you're wearing men's clothing, you're definitely going to go to hell. And then we'd come home and we'd mention this to my dad, and my dad said, "It's none of their business." Yeah,
Absolutely. Yeah. Yeah.
and he'd said that, you know, you do what's right by you, and people should do what's right by them. And if somebody says anything more to you, then you can give them a stern reply on my behalf. And I'm not interested in what other people's opinions are. If you
MashaAllah.
try
Yeah.
to please other
I can,
people, you will never
yeah.
win in life. So you've got to do what's right by you. And I remember people saying to my dad, "Oh, you're sending your girls to a mixed school. They're going," and he said, "Yes, and." Wow, they will have boyfriends then, because they'll be in a mixed school. Aren't you worried that they will take up a boyfriend and so on? And my dad said, "Well, half of society is male, so I'm not going to be able to guard them from half of the society all of their life. And I have trust in my children, and I'm not going to send them to a girls only school, which is 2 bus rides away, and I work nights, and their mother won't be able to get to the school,
Yeah.
navigate herself on a bus when she's non-English speaking, if there was
Yeah.
any problem during the daytime. And actually, outside of the girls' school gates, the boys are flocking like flies to bees,
Yeah.
bees to honey. So
Yeah.
yeah,
Yeah. Yeah.
and so on and so forth. So those, and I think that was so for me. Then I didn't have anything from the community point of view. If they said it, then they certainly didn't say it to my face. If
Um,
they said it to my parents, they've got an appropriate response.
yeah.
And we were definitely, I suppose, the outliers,
My,
in the
my,
20.
Yeah, no, mashallah, I'm really reminded of when you're saying this about my own mother. So my own mother was brought up in a place called Jhelum, and in the sort of 50s or something. And her dad was a kind of a bit of a, I would say, an outlier as well. He sent all his girls to college in Peshawar, so they had to go away from their place in Jhelum, and they all got an education. They're now the children are all doing very well. But what I realize is that it reminds me very much of it because I think for a man to educate his daughters and give them that trust and send, give them that freedom to be able to pursue their educational goals, it takes a certain strength and it takes a certain amount of almost feminism. They're I would call them they're the real feminists. And although my grandfather had a big beard and a turban, but he was actually a feminist in that nobody could understand how are you sending your girls away to another city, to a university, to a college? What's that all about? And the whole mahalla, apparently the whole area used to sort of talk about it and everything. But I'm saying he would, but it's in a way what you're saying, it really reminds me of that. And your dad sounds like he was a honestly quite a special guy.
He is,
And I
alhamdulillah.
had to have been a quite strong guy, I think,
That's right.
to
Yeah.
and committed to carry
Yeah.
on with that.
That's right. And then when I went to university in Liverpool, then, my father had all of this from the community around him. You're sending your daughter to a whole different city.
Mm.
My goodness, aren't you worried that she will take up a boyfriend and, and that would be, egg on your face and, and so on and so forth, mm, um, affect your honor and blah blah. And my dad said, "No, I have trust
So
in my children."
what would you say to people who want to send, who are in the position where they might have to send their daughters to another university? What would you say to them? Like, especially in Glasgow, I know lots of people who wouldn't even send them to Edinburgh, let alone, somewhere further away. What would you say to them?
I'd say that you have trust in your children. Hearing my father say to these people, "I have trust in my children," was really powerful. He never told us, do this or don't do this. He never said that. But yet, because he had so much trust in us to do the right thing without telling us, we wanted to do the right thing. And I think that's really important, to let your children know that you trust them and they will do the right thing.
Mashallah. Sister, we've only got 10 minutes left, and I can't believe the time is literally flying by. So I've got to ask you about your job now. You said, I mean, yeah, what does your job now involve? You said a lot about
So my job
organ
now, my
transplantation as
titles
well.
are that I'm a consultant nephrologist. That means I deal with kidney disease, but I'm also a transplant nephrologist. I'm the medical lead for kidney transplantation at QEHB, and that's my subspecialty, is that I see people who need a kidney transplant, and then part involved with the assessment, and then the perioperative care and the long-term management of kidney transplant patients as well. I'm also the vice chair for the West Midlands Transplant Collaborative between Oxford, Coventry and ourselves, so that we can ensure that we don't turn down kidney offers for logistical reasons. We can send our patients with the kidneys to partner transplant centres. And I've also been a long-standing volunteer for a charity called Transplant Links Community, and I'm now the governance lead for that charity as well. And this charity, we work with low to middle income countries to help them develop sustainable kidney transplant programs. So I've traveled out to Ghana, Jamaica, Papua New Guinea, and the focus is on transfer of skills. So we have our nurses working with their nurses, us as nephrology doctors working with their nephrology doctors, our transplant surgeons working with their surgeons to transfer skills. And we go out and do transplant missions, but it's very much about supporting the skill development and the development of kidney transplantation in countries where it does not currently exist.
How do they react when they see you with the hijab and everything? Is that a surprise, or are they happy to see that?
They're happy to see that. Yeah, they're happy to see that. I find that people have a lot more respect when they see someone who is true to their faith. And it's always been a positive reaction. Yeah.
And I've got to ask you that, when I was growing up, there always used to be this debate about, can we transplant? Can we donate? Can we not donate? I know how I stand on it, but what's the definitive point of view as far as you're concerned about organ donation now?
It is definitely halal. There's
Hmm.
been the confirmation from many scholars across all the different schools of thought. And, I think when people say, oh, well, it's tampering with the body and that's not allowed in Islam, but what they're relating to is a time when the non-Muslims used to make cuts on the Muslims' bodies to as damaging them, but this is surgery. This is not the same kind of thing. This and removal of an organ is like an operation, and there is a lot of respect that's given to the deceased donor. And saving a life, we know the importance of that in Islam as well, and so it's very much allowed to give organs after. It's the soul that's going to be accountable on the day of judgment. It's not and Allah subhanahu wa ta'ala can resurrect the body even when the organs are donated. So there's no real impact in that kind of a way, and the whole notion that we must return our body in the way that it was given. Again, the scholars have said that organ donation is not a contraindication, even in the realm of that as well.
I see. Just talking about organ donation and kidney donation, I mean, I have to mention at the moment, I know we talked about this before the interview, but, I've been hearing a lot of things going on in the Middle East, sadly, in Gaza and places like that. And I'm hearing about people whose bodies have been returned back from prisons with the organs removed. I mean, and I almost can't believe this, but is that something that's a reality that you've heard of?
I have, unfortunately, and China is an example, and this has been long known about China, and it's treatment of prisoners, where prisoners' organs are removed without consent. There are people who are even killed for their organs, whilst they're under police custody as well. And people from Western countries traveling out for heart transplants and so on and so forth. And, this is, there is a lot of work that's been done and is being done to try and deal with that, and that's an International Transplant Society to speak up against that, and also to report any organ trafficking behavior that you become aware of. So yes, it does happen.
Okay. Is there any moves to stop that? Is there some sort of
there's a lot of work that's been done to stop this, and within the UK now it's now a legal requirement for healthcare professionals to inform the Human Tissue Authority about anyone that has received a organ outside of the UK, and then they look into this formally, just to ensure that there hasn't been any misconduct. People haven't been leaned on to sell their organs.
I hear about people going abroad to Pakistan, for example, to get kidney operations. Do you have anything wrong? Do you think there's anything wrong with that ethically, or do you think
if it's done ethically, there's nothing wrong with that, because Pakistanis and people of ethnic minorities, they will often have a different. There's difference in blood group, there's difference in tissue type, and therefore, in the UK, unfortunately, not very many Asians, blacks are donating organs compared to how many of Asian blacks are on the wait list.
Oh, really?
And
Okay.
yes, it's majority Caucasian donors as well. So that you have more chance of a tissue match from within your own ethnicity. And if your family is living, extended family or family are living abroad, then to go out there and have a transplant in a reputable centre where there is a ethics committee and everything is checked and ensured that there isn't any exchange of money and it's all above board, then that's fine. But unfortunately, what we find more often though is people go abroad and say, a cousin has donated, and often it's a maid or the poor person that they know of, and they've paid to have their organ.
It's kind of sad, but Sister Shazia, it's been an absolute pleasure talking to you. Before I finish, I'll ask you one last question, which you ask everybody. What was the best piece of advice anybody gave you about your career?
I think the it was.
Or
I
it
think
could have
the
been
best.
your education even or something.
Yeah, I suppose the best is that the thing. When I was at a conference and one of the speakers had said, aim for the moon, and if you fall short, you land on the stars.
That's good. I like that. I like that. MashaAllah, Sister Shazia, that has been an absolute pleasure speaking to you. I think this is probably one of my favorite interviews. I really enjoyed that. We could be talking for another couple of hours. There's so much that everybody can learn from you, not just the sisters, but the brothers, the young people, and probably even the elders can look back at this and see things in their parenting that they could learn from. So thank you very, very much. And inshallah, speak again soon. Thank you all the listeners for listening in on Radio Ramadan 87.7 FM. And this has been What's Your Speciality? We changed the name actually. We haven't actually got a name for this section, but we'll be doctors talking to doctors. And inshallah, join us again for our next program. Sister Shazia, thank you very much.